This channel does not promote or encourage any illegal activities. All contents provided by this channel is meant for educational purpose only.
Good evening to all the viewers who are watching live and will be watching on a recorded version. It's me, Mukherjee, with you as the IT manager again. So basically, let's begin with the e-participant certificate. I guess there are some issues, and today's e-participant certificate will be closed for now. We are trying to work on it. If it is on, then we will just show up the flashcards. Just keep a notice on the flashcards. If you see it, then just go and do the auto e-participant certificate. So without wasting any more time, let's just jump into our 30 seconds countdown time.
Good evening, sir.
Good evening. Very good evening to all of you.
Good evening, everybody. Before we start today's CME, we like to pay our respect and support to the Indian Army who had been fighting a fearless battle across the border of our country. And with the ongoing onslaught of our neighboring country, we are really worried about the people who are living across the border, and many of our alumni are residing in the northern sector, especially in Punjab, Jammu and Kashmir, and Rajasthan, Haryana, Chandigarh. So we like to pay homage to the people who had lost their lives in this period of Operation Sindoor of our country. And also we support those brave fighters, those person and the women who are fearlessly fighting the brave battle. And with your permission tonight, sir, let us call on tonight's inaugurator.
Please call.
Thank you, sir. And slowly but steadily, we are reaching towards the 125th mark. Tonight we have 116 CME, and it will be the part 2 of a CME held in 114. To inaugurate tonight's CME, let me call on that great doctor and we are proud that he is an alumnus of NIH, Dr. Parvez. Dr.
Good afternoon,
Parvez
everybody.
Ahmed Khan, stage is yours.
Thank you, Bidyut. Thank you, sir. Kalyani, sir, thank you. Thank you, Bidyut. Now, and no more wasting time. Today's topic is an insight into thyroidinum, insulinum, and carcinosin, a study and discussion in relation to everyday clinic. For this, today's speaker is Dr. Vivekananda Chakravorty, 10th batch NIH, my batchmate and beloved batchmate. He gave a nice seminar in the last CME. So, without wasting time, I call the moderator of the today's CME, Professor Dr. Abdul Motin Mollah, Department of Community Medicine, Nehru Homoeopathic Medical College and Hospital, New Delhi. Now,
so good evening.
Yeah.
Good evening, Dr. Parvez, for introducing me here. So, respected Dr. Kalyani sir, Dr. Bidyut, the President and General Secretary of our NIH Alumni Association, and good evening all the viewers as well. So, this is the second part of our seminar this on the topic on this insight into the thyroidinum, insulinum, and carcinosin. And on 114th seminar, so the discussion was on the insulinum, and carcinosin. And the remaining medicine, the thyroidinum will be discussed today. The first thyroidinum is a very important nosode, circuit. So, and we basically need no introduction about the Dr. Vivekananda Chakravorty. But as it is our seminar CME is a global one, so for this reason, again, the Dr. Vivekananda Chakravorty, he is a third generation homeopath, and he is a very devoted, this actually voracious reader and devoted homeopath. Homeopathy is not only profession as well as passion to him, and this who has listened him last in during the last seminar, they knows about the length and breadth of his knowledge about the homeopathy and in the particular topic of our discussion. So without, and Dr. Vivekananda Chakravorty, especially, he is actually, what is happening, he is treating this actually a large number of the pediatrics patient, and I am also attending one pediatric OPD at Nehru Homeopathic Medical College and Hospital. Many a times I also prescribe this thyroidinum, but like all the other viewer, I want to learn from the Dr. Vivekananda Chakravorty also, and I am very optimistic about that. At the end of the today's CME, that everybody will learn about the thyroidinum from Dr. Vivekananda Chakravorty. Now, without wasting much more time, I welcome Dr. Vivekananda Chakravorty. Dr. Vivekananda Chakravorty, please, now the stage is yours.
Thank you very much. Thank you very much. Am I audible? Am I audible?
Yes, you are audible.
Am I audible?
Yes, you are audible.
Okay, thank you, thank you. A very good evening to all of you. Respected Dr. Kalyani sir, respected Dr. Bidyut, respected Dr. Abdul Motin, and beloved Orko and my batchmate, Dr. Parvez. So today I am going to discuss the last part of my CME. Actually, I asked to Bidyut, I asked Bidyut that this could be done in 2 seminars, as it would be difficult for me to detail about the 3 drugs in 1 seminar. So the only part is thyroidinum today. But before directly going into thyroidinum, I would like to speak a few words about the last one. I spoke about, I'm starting just now because I spoke about the drainage remedy, the Tuberculinic and the drainage remedy by the French school of the homeopaths in last seminar. So little elaborating on that. After that, I'll be, as I said earlier in the last CME, that is 114th CME. So the drainage remedy, the concept of drainage remedy came from the French homeopathic school, and one of the leaders of the French homeopathic school was Dr. Leon Vanier. He had a very typical way of understanding the cases, as well as he had a very specialized technique for the prescriptions. He used to prescribe remedies on different aspects of the mental symptoms, on the physical generals, on the particulars, and also sometimes he used to give medicines, prescribe medicines on an alternate basis. Say one drug in 30 potency for 7 days, then another drug in 200 or 30 potency, or maybe in 6 potency for another fortnight or 7 days. So I'm not going into that because that is somewhere in the posology or in the dose, the administration, the repetition of the medicine. There are many views regarding that. But about the drainage remedy, what he spoke about from the different books which I could gather the informations I'm sharing with you now. It would just take 5 to 10 minutes. After that, I will be going into thyroidinum directly. So, as the name signifies, the drainage remedy, the remedy which drains. So, as it is a drainage remedy, so the remedy which drains. So, what does a drain do in our home or in the streets? So we get drains. So what does it do? It takes it takes the toxins and it takes them out to some maybe it is in any river or in any of the river water body or so. So that is what is done by the drainage remedy. So if we consider the drainage remedy, we will get the drainage remedy from the different miasms. As we see, there are different miasms, soric miasms, psychotic miasms, then syphilitic miasms, then tuberculous, and then the latest one, the newest one, probably the cancer miasms. So from that perspective, from the miasmatic perspective of the remedies, it is not that always the nosodes which can drain the toxins of the case. Here I should mention one thing: that toxin means it doesn't mean that the bacterial toxin always. The toxin means here it is not the literal meaning. The toxin means the aberrations, the pathology, the change which is not physiological in the patient. Those are being represented. Those are we get those things. We get those symptoms from the picture of the symptoms. From those things, from the symptoms itself, and from the constitution sometimes. So they hello. 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 Hello.
You are audible. You are audible.
Okay. So there are certain drugs which the French school homeopaths they are advocating. These drugs are useful for the drainage. As if they are telling that the system gets activated by the drainage remedy. So that can be given by the constitutional basis, that can be given by the relying on the particulars, relying on the generals, relying on the mental symptoms, whatever it may be. But what important point they are telling, the French school of homeopathy, especially the Leon Vanier, that please give a remedy which is most similar to the case, and at the outset, in the beginning, very beginning, and which is preferably not a nosode, Say you are getting a patient of natramur, go for natramur. Then there are relations or there are correlations. There are similarities, or you can say like the action of the satellites, the function of the satellites. There are satellite remedies from if we consider natramur, and if we consider the symptomatology of natramur, most of the symptoms of natramur corroborate with the tuberculous pathology, the tubercular miasm. So then we are uniting this natramur to the case with some nosode at later part of time for a more deeper action. I just read 1-2 lines, it would be better. Another term you will come, I am reading it from the book, The Compendium Lectures on Homeopathy by Professor Dr. Dion Horischand. Another term you will come across is drainage. Briefly, the contention of the French school is that when a person is ill, his system is saturated with disease and toxins, not used in the literal sense. So drainage or detoxification consists in cleaning up of the state by the indicated remedy and then giving the much deeper acting isopathic remedy in bracket nosode. So It's no sort. It's not. I'm not going into the purview. I'm not going into the details of the isopathic remedy, the things, as the nosodes are prepared from the disease product itself. So it is written like that. So this is what the concept of drainage remedy is, and under this concept there are two main types. One is tuberculinic type as per the French school, and another one is cancerinic type. So there are different symptoms which we get from the pictures of the tuberculinic and as well as the pictures of the cancerinic, which you get from the indicated remedy or the polycrest itself. Like for an example, a tubercular patient, say I am taking an example. It's a very detailed discussion. If I get a chance to speak about this, I may speak it later on in other CMEs. But to be very in the in nutshell, I can say a few symptoms. I can elaborate a few symptoms of the tuberculinic. Then it would be better for you to go into the stream. I mean, the understanding the aspects of the tuberculinic. What does it mean by the French school of homeopathy? If we see a tubercular patient, if we see a patient, he is very tired, especially he is very tired in the morning, he catches cold easily, he has a feeling, he has an empty feeling in the chest after 2-3 breaths. I mean, say some patients we get after inspiring, say 3-4 breaths, he gets fatigued. So easy fatigability. If we get Stannum metallicum, it's a very it's a great tubercular drug, Stannum metallicum. You have a strong symptom, empty feeling in the chest in the Stannum metallicum patient. So that is what you are feeling, breathless often. So you are very tired easily, especially you are not easily you are not easily aroused. I mean, in the morning, if anybody calls you, get up. So it is very difficult for a tubercular patient to get up in the morning. So as we get in the MAC curve, magnesia curve, one strong symptom is patient is more tired in the morning after a refreshing sleep than in the night when he is going to retire. So that is a tubercular stigma, we can say. So there are there are array of symptoms, like the sudden onset of symptoms. We get sudden fevers, sudden viral episodes in children. This is tubercular stigma again. These children grows quickly. You know, the bones are very tall. I mean, the long bones grow too rapidly. So that is a tubercular stigma again. They have headache often. They commonly suffer from headache. We know from the Materia Medica, Tuberculinum, Calcarea Fos, these are the very tubercular drugs. They are having schoolgirls' headache, schoolboys' headache. So that is another tubercular stigma we get in the daily practice. And frequent cold or frequent diarrhea. Even the diarrhea is a tubercular symptom. You know, from the tuberculosis point of view, they do suffer from diarrhea often. In the ancient days, if you see the books, diarrhea is a common symptom in the tuberculosis patients. So next is they have a changeable mood, they have the changeability of symptoms, and there might be a rapid change of the symptoms. So they are usually chilly subject. As the tubercular drugs, mostly we find the chilliness. I mean, the Silicea, the Calcarea carb. Natramur is not very chilly, but if we see Barnett, Dr. James Compton Barnett, he describes Natramur as a chilly one, and Natramur is a very good tubercular drug. And they have a very strong symptom, demineralization. They have carious teeth, teeth caries. I see many cases of children, early caries. This is tubercular stigma. And they have a very strong component in the cardiovascular system. They have sinus tachycardia. This is a very good clinical hint for the tuberculinic patient. They have sinus tachycardia. You're not getting any pathology, but whenever they go for the ECG, the pulse rate gets high. I mean, it is more than 100. There is no pathology. There is nothing. There is no ventricular pathology, nothing. But there is a simple sinus tachycardia. It is a tubercular pathology. They are usually hypotensive. They are often giddy. If you see, many patients come to me, the school-going children, they say they have fainting spells, they have vasovagal attacks, vasovagal syncope. Doctor, my child is standing in the queue, suddenly he fell down. So you are not getting any pathology. You have undergone all the tests and all. So this is vasovagal syncope. This is another one for the tubercular stigma or the tuberculinic patient. They have a very bad position in sleep. Like all these positions of sleep, knee elbow position, knee chest position, position in a curled up position, lies on the abdomen. So these are all tubercular stigma. And there are a few remedies from if we get the stigma. The natramure is what Dr. Dion Horischand is advocating us. The natramure is one of the very important remedies for the tuberculinic type. And whenever you are prescribing natramure, the satellite is in the tube. In the satellite drug would be the tuberculinum. Sometimes in the course of the treatment, you may need tuberculinum, or you are certainly going to give tuberculinum at some point of time. So there are many, arsenicum album is there are phosphorus is there, stannum, which I spoke about, the iodium is there, the calicurb is there. So this is one which is tuberculinic, and the drainage remedy part. So what the French school is telling, you are giving the medicines, you start giving the start prescribing the with the drugs of the tuberculinic type, and then in the course of treatment give tuberculinum for a more deeper actions which I read about. So again, now if I go with the another one which I spoke about, the cancerinic state, they have a very strong fear of cancer. That is, I don't remember exactly which I mentioned or didn't mention in the last CME. As it is the second part, so I should speak some about those from the earlier CMEs. So they have extrinsic grief, sorrow. The element is very strong in the cancerinic patient. They have these things are embedded in cancer patient. See, as the cancer, how if you see the evolution of a cancer, the person doesn't know anything. One fine morning, a gentleman spits up blood in the wash basin, and he went to a he went to a doctor. The doctor did a chest X-ray, and there's a growth in the lungs. In the chest X-ray, it is found there's a lesion in the chest X-ray. So then the further investigation was carried out, and eventually it is a case of cancer. So from my little understanding, I can say in the cancerinic state there is a control always. Control. Even if you see the cancerinic, you don't get them very outspoken all the time about their grief, their sorrow, their emotions. So this is cancerinic, and they have the progressive. They have the progressive toxic impregnation inside the body, which is not known beforehand. It's after some time the doctors came to know when the manifestations are there and the relevant investigations are done. So even they have the intermittent pains. The pains are not very not very regular. They have the intermittent pains. These are the very strong symptoms of the cancerinic patients, which I spoke about. They have a very strong fear of cancer. Whatever they have, even they have a cyst, a simple sebaceous cyst, they come and they tell you that, doctor, is it not turning into cancer? So this is a very strong symptom of the cancerinic state. And they have the functional troubles of the intestines, of the liver, of the kidneys, and all. About the intestines, I spoke about the flatulence and the irritable bowel syndrome and other things in my last CME, that is 114 CME. So even that functional disturbances of the intestines is also very prominent symptom of the cancerinic state. And they have their digestive symptoms also. They have all sorts of these GERD symptoms. The taste is bitter, the taste is sour, they have the acidity, they have the gastroesophageal refluxes and all. So these are some of the symptoms from the cancerinic, I mean the intestines and the digestive systems, as far as the digestive systems are concerned. They have certain objective symptoms also. You get the acanthosis nigricans. It's a very strong clinical hint of the cancerinic state. Acanthosis nigricans, you all know what is acanthosis nigricans is. If you get an acanthosis nigricans on the skin, there may be association with diabetes, there may be association with some other diseases also, but you will certainly get this acanthosis nigricans sometimes, and it's certainly a cancerinic stigma, as a cancer stigma. So then again, they have other symptoms, like they have the polarity of the symptoms. You may get the, as well as they have the strong aversion as well as the strong desire for some food items. Today they are taking sweets. Tomorrow they will be telling that no, I don't like sweets, give me some spice. So the very next day, even they might like some salt items. So that is also very important in case of the cancerinic state. And they have the glandular swellings, they have the tumors, they have the cysts, they have the aberration of the growth in different parts of the body. Certain parts, I mean, there's a swelling that grows in a different way. That is the growth is not regular. There's an irregular growth. So that is something which is very important in cancerinic state. They also have the wasting, wasting, wasting. And they have the hypertension. They have the hypertension also, arterial hypertension, which we say from the practice of medicine. So even you get some other symptoms in the cancerinic, some good hints, like the corners of mouths are cracked, like in the condurango, like in nitric acid. So these are the hints, clinical hints for the cancerinic states. And there are other symptoms also, because the whatever you get from the carcinosin, mental symptoms of the carcinosin and other drugs of the cancerinic background. I mean, the cancerinic state, you will get all the symptoms if you just go through the different literatures. And there are different drugs which Dr. Dion Richard is telling about the cancerinic. It is for the drainage of the cancerinic. There are some drugs which he advocated for the glands, like the carboanimalis, like the conium, like sedum acri, then scrofularia nodosa, we all know. For the skin, it is euphorbia. It's a very good anti-cancer drug, we know. I mean, anti-cancer per se, I'm not telling that it's, if you give it, it prevents the cancer. In some forms of cancer, it helps. So in stomach, condurango, which I spoke about, ornithogalum, we know. Rectum, for the rectum, it is Hura brasiliensis and then ruta. And for liver, we all know the chelidonium, the carduus marinus, the conium, the cholesterinum. For the kidney, the solidago, the chimaphila. For the spleen, the Cyanothus americana. For the uterus, the Thalaspi bursa-pastoris, the Helonius, and the cinnabaris also sometimes. So these are the drugs for the drainage remedies. I mean, as far as the drainage remedies are concerned in cancerinic states. And nonetheless, the carcinosin itself, it is the scerinum, the carcinosin, they are the great pivots for the cancerinic states. Even if you get from my last CME, as I told, if you get the history of cancer in the family, you are at liberty to prescribe carcinosin to him. I spoke about one case. I am just recapitulating that. One lady came and she had flatulence and nothing particular which I got from any other pathology or anything. So and she had her mother. I mean, she had cancer in her family. Her mother died of cancer. So immediately I jumped into the prescription carcinosin. So that is what the French school tells us about the cancerinic and the tuberculinic. So you must first prescribe and indicated nearer to the patient, I mean nearer to the case, then going for the carcinosin or the tuberculinum or the drugs which are of the tuberculinic and cancerinic type as far as the case demand. So these are all, I mean, from the as I spoke last time for the drainage remedies. So I thought that I should speak this, and I have just spoken about. Now I am just directly going into the thyroidinum. Maybe I am a little late. So for thyroidinum, the first point which I want to mention is where I don't prescribe thyroidinum. I start with the negatives, then I would come with the positives where I give thyroidinum. I don't prescribe thyroidinum in a case of myxedema. I don't prescribe thyroidinum in a case of cretinism. I mean, I don't remember whether I got any case of cretinism so far or not. I don't prescribe thyroidinum in a case of thyrotoxicosis as well as hyperthyroidism. So these are some dark zones which I call. I mean, it's my understanding about the thyroidinum. I never prescribe thyroidinum per se in those cases. In those, if a patient comes to me, he tells me that, doctor, I am having I'm a patient of myxedema. It's not that thyroidinum I am going to prescribe in any potency or any of the potency of the drug. So my first point about thyroidinum would be allergy, which I want to mention. Nowadays, it is a very common scenario of in the patients. We get allergy. There are various forms of allergy, and sometimes this allergy gets manifested by urticaria. And if we speak about urticaria, there are many types of urticaria. So there are many rubrics as far as the urticaria is concerned in the repertory. So I am just going a little fast about the urticaria. I just go as I made it. I just read out. There are main two headings in urticaria. One is acute type of urticaria, and another is a chronic type of urticaria. As far as the practice of medicine or the allergy books, what is said, the urticaria which is persisting for less than 6 weeks is acute urticaria, and the urticaria which is more than 6 weeks, I mean that is persisting for more than 6 weeks, those are chronic urticaria. So the acute urticaria, you have in both the cases you get the identifiable causes and you may get the non-identifiable causes. And in most of the cases, I mean in everyday clinics, it is very difficult to find a single offending thing or multiple offending thing for the urticaria in that very particular patient. There might be multiple, I mean, it's an allergy to multiple things. Sometimes it is very difficult to get. And the most important part which must be considered by the doctors, that is, most of the urticaria are idiopathic. We don't know, we know the pathology, how the evolution of urticaria, all the mast cells and the histamines and bradykinins and prostaglandins. We all know that from the pathology, and all the well response and the vasodilatation and the erythema part. If it is bigger, it is angioedema and all. It is sometimes extremely itchy, and not to, I mean, it's very important to mention that in case of thyroidinum, these lesions are extremely itchy. I mean, itching lesion, the urticarial lesion. So the identifiable causes are food like this soy. I get many patients in pediatric setup, the soybean allergy, the peanut allergy, the wheat allergy, the fish allergy, the shellfish, the shrimps, and the tree nuts, sometimes allergic to those foods. The chemicals, the different types of chemicals, there are a large number of chemicals to name. There are different irritants. See, during the time of COVID, we used to use the gloves, the latex gloves. It's a very strong point, the latex, allergy to latex, thyroidinum. very strong point. Many, many have experienced, maybe, I don't know, but we do have the athletics allergy as it comes under the heading irritants. So there are infections, a very, very important thing. Sometimes we have urticaria, there is an embedded infection inside in the body. It may be a viral. I can speak about one infection. The patient sometimes gives the picture of urticaria, that is mycoplasma infection. We have this infection that is not a bacteria, that is not a virus, that is a very small organism. And if we take the allopathic signs, I mean, the azithromycin is a very effective drug for the as an antibiotic. Azithromycin is very effective in mycoplasma infection, and in mycoplasma infection you might have urticaria. You in parasitic infection you might have urticaria. There are different contact allergens. You have urticaria in that, animals and plant toxins and the allergens. You have the physical triggers, well response. I remember one case. A patient came to me. So whenever he was pressing tightly, when he was holding his hands tightly, and after releasing the pressure, there is a well response, and it is like dermatographism. We have the rubric in our repertory, dermatographism. There are many drugs. Phosphorus is a bold red drug, and there are other drugs also. I cured the case with calcarea cub, and not to mention the lachesis also is another very important drug for urticaria. So there's a well response if you have a pressure, if you apply pressure on the part, and then insect bites, stings. This is a very common finding. We give lidum often we give lidum, but even in the course of time, in the later period of time, you may have to give thyroidinum to the patient. And there are different medications. We also in modern day scenario, we have to take the history of the allopathic medicines as well. ACE inhibitor, angiotensin converting enzyme inhibitor, ACE inhibitors, enalapril, captopril, ramipril, these drugs also sometimes can give result to the urticaria. Sometimes it is not that all the patients are suffering from urticaria if you're taking these drugs, but sometimes it may so happen we have the option of taking. I mean, we should take the history in the background. There are some comorbid conditions also, the autoimmune conditions, the pregnancy. There are some lymphoproliferative disorders. There are some endocrine issues where you can get urticaria. This is all in the acute setup, acute urticaria, which is of less than 6 weeks duration. So in all these histories and the urticarias, thyroidinum is a very good indicated drug. In the course of the treatment, my doctor friends, thyroidinum must be thought of. And now the physical urticaria, I mean, these are all physical urticaria and angioedema. I am talking about which is more than 6 weeks duration, the chronic urticaria. You have the autoimmune diseases like the rheumatoid arthritis, like you have the SLE, you have the Still's disease, you have the juvenile rheumatoid arthritis, you have the Sjogren syndrome. These are also syndromes because we get these patients in our clinic. And urticaria may be an associated symptom, and nobody knows that thyroidinum might get indicated in those cases. So why I am elaborating this? Because these are the this is the range of our everyday clinics, as my topic is insights into the drugs in everyday clinics. So these are the scenario we often get in the everyday clinics. So there are physical triggers which I spoke about, the dermatographic urticaria. You have a good rubric, dermatographism in the skin, in synthesis as well as in other repertory. And you have other urticaria also. You have many drugs under the rubrics. One is cold induced, heat induced, like the heat amelioration and the cold amelioration. All these symptoms are there, all the drugs are there. But remember, my friends, thyroidinum is a very good drug for those. And there are some aquagenic urticaria, there are solar urticaria, sun-exposed skin. It happens on the sun-exposed skin, delayed pressure urticaria, vibratory urticaria. And the chronic infection, I spoke about the Epstein-Barr virus infection in my last CME, the Paul Bunnell test and the infectious mononucleosis, which is more common in the temperate zones, in the temperate climates, in the developed in other countries also. So the Epstein-Barr virus infection, then hepatitis B infection, hepatitis C infection is a very common. Sometimes in hepatitis B and hepatitis C infection, you might land up getting the case, the symptom of urticaria, extremely itchy skin. Skin lesion, urticaria in hepatitis B and C infection. In hepatitis B and hepatitis C, these are the chronic infections, and then helminthic infections. Then so very important in today's scenario, H. pylori, Helicobacter pylori infection, the urticaria again, Helicobacter pylori infection. I had a case of treating such infections. You have the test, you do a gastroscopy, and then there is a test. When the gastroscopy is passed, the gastroenterologist does the test, and if you get the test H. pylori positive, they go with the regime, Helicobacter pylori eradication regime. So you are getting it in the history, the H. pylori infection, and when you are asking the patient about the elaboration of his symptoms, about the history, you may get the symptoms of the urticaria in him, and you may end up giving him thyroidinum. So these are all about the urticaria and thyroidinum, and from my clinical perspective and point of view, it's a routine prescription. As I spoke about, I told my sometimes my juniors, my students that please keep the stock of carcinosin as well as the thyroidinum also ready. It is always ready, thyroidinum 30 and thyroidinum 200 and also thyroidinum 1M. These are always ready in my clinic. I mean, ready stock is there. So this is a very good indication. If I get a case of acute urticaria, if I get a case of chronic urticaria, if I get a case of history of urticaria, it's a fair chance I prescribe thyroidinum at the very beginning. As I always don't prescribe the single remedy all the time, I may give another remedy, say thyroidinum in potency 200 potency, and then some other drug which may be specific for the urticaria, maybe Apis mellifica, maybe antipyrin, maybe sometimes chloral hydratum. So, but to me, thyroidinum is specific for urticaria. It is also stated by some other stalwart homeopaths as well. Now, another very important aspect of thyroidinum, which I must say, that is the vasomotor phenomenon. In my clinic, which I understood, and I'm learning that I have been learning the different vasomotor phenomenon, and specifically, I should talk about the vasomotor rhinitis. What is vasomotor rhinitis? It is a perennial non-allergic rhinitis. See, in one setup, in the allergic rhinitis, it is a very good drug for rhinitis. I will come to that, but it is as well as very good for for also vasomotor rhinitis. What is vasomotor rhinitis? The rhinitis minus the allergic aspect. The rhinitis, the patient has the perennial rhinitis, all the symptoms of rhinitis and all, but minus any allergic trigger is called the vasomotor rhinitis. You can say you are not getting any allergic trigger, even if you are not in a position to know what is there exactly in the pathology, but patient sometimes start sneezing. It's a 30-40 sneezes on and off. So it is, I don't know, it is the enhanced reactivity of the nasopharynx to the non-specific stimuli. We don't know. I don't know what are the stimuli are, but sometimes we get these patients. There may be different stimuli which we don't know as of now. So this is a very good indication of thyroidinum. In my clinic, if I get patients with the allergic rhinitis as well as the non-allergic, I mean the vasomotor rhinitis, if we get the symptoms of sneezing, perennial, on and off, coming and going, I blindly, sometimes I take the word blindly as I give thyroidinum in such cases. And there is, if you go perform the test like the eosinophilia and all, the allergic etiology you might not get in the case of vasomotor rhinitis, but certainly thyroidinum is going to give you some result. And now therapeutically in pediatric age group, it's very often indicated in seizure disorder. It may be given as a reactive remedy in cases of seizure. We do often get cases of the epilepsy in our everyday clinics. And my doctor friends, please remember thyroidinum for such cases. You may need to give thyroidinum in the course of the treatment in such cases. Whatever the remedy you are prescribing, whatever the medicines they are taking, either allopathic or homeopathic, from your point of view, from a homeopathic point of view, you should prescribe thyroidinum sometimes into that to that case for a preferable action and a better follow-up, I can say. So in cases of unexplained headache, why I call unexplained headache, you are not getting anything. You did CT scan, you did MRI, you did other things, cervical spine X-ray and the MRIs and all, and you did other also, I mean other tests if indicated by the cases and all, but you're not getting any pathology, you're not getting anything from the investigation. So it is unexplained somewhat. His eye is correct. Sometimes I tell the patients to go to get their eyes checked by an ophthalmologist, whatever is there in the mainly the pediatric age group patients, whether they have myopia or not. Please rule out myopia. So even after getting everything normal, you are not being able to get anything. It's a reactive remedy in case of the unexplained headache. So what Dr. S.C. Ghosh in his nosodes, my experience with Rayan nosodes, what he is telling, what he is stating that he is stating it is, even I have verified it clinically often. I do verify it clinically in my clinics, everyday clinics. This is, they have the children having high metabolic rates and high metabolic demands, growing too tall, growing too rapidly. There might be some irregularity during the time of growth. They often fall sick, have fever, have different catching cold easily, difficulty with the dentitional issue, difficulty with the hormonal issues in case of girls. It is thyroidinum. It is again thyroidinum. It is what Dr. S.C. Ghosh is telling, during the time of the growth of the children, thyroidinum is often indicated. Thyroidinum is very much indicated sometimes. Now, if we a little elaboration I am going into, we get many babies and toddlers vomit often during infancy and early childhood. I spoke about cyclical vomiting syndrome and carcinosin and phosphorus also. Again in the cases of the cyclical vomiting syndrome and in different GI disorders, where you get the symptoms of the vomiting on and off in case of little children, the toddlers and the babies, thyroidinum is very good, is a very good drug. You get, so one point is cyclical vomiting syndrome, and the another one is you are getting a vomiting. It's a case of vomiting. You are getting cases of vomiting where you are not getting into any pathology, but there's a failure to thrive. Patients, the child's mother is telling you that what I am going to feed him, whatever I feed him or her, he is going to vomit it out. So it's very difficult to feed him, doctor. So it is thyroidinum. So what Dr. S.C. Ghosh is telling, that this issue has to be, this infancy and toddler, the vomiting issue has to be addressed with proper clarity and analysis of the case, as this may lead to malnutrition and poor growth. Thyroidinum is often indicated in 30 potency as per Dr. Ghosh. I do prescribe in 200 potency also in such cases. It has been verified clinically often. And now it's a very important hint about thyroidinum. That is, you can give it as an adjunctive drug. What is adjunctive? ADJUNCTIVE. Adjunct is adjunct. See, in a case of cancer, as far as the allopathic therapy or the modern medicine is concerned, sometimes what they do, they give a chemotherapy regime, one or two, or that depends on the case, and after they perform the surgery, and after the surgery they go for the therapeutic chemo as well as the radio sometimes, or radio, or vice versa. I mean, sometimes both or one of that. So this is one of the indications. I mean, this is called the adjunctive therapy. See, there is a mainstay of the treatment, and with the main stay of the with that level, I mean, with the mainstay of the treatment, you are giving some form of therapy in the form of giving chemotherapy, or maybe injection, maybe whatever, maybe the supplement sometimes. So that is adjunctive therapy. Thyroidinum. I'm giving you another example. Sometimes it is possible to have the pyridoxine deficiency, vitamin B6 deficiency in the cases, in the patients of tuberculosis who are taking ATDs or AKTs, anti-tubercular drugs. I mean, the allopathic anti-tubercular drugs. Pyridoxine deficiency. If we read the pharmacopoeia, if we read the allopathic pharmacopoeia, we get you can give a supplement. I mean, the allopathic doctors, they give the supplement vitamin B6 pyridoxine for you can say it as an adjunctive remedy or the drug. It's a supplement, vitamin B6, but you are not. It's not doing anything with the tuberculosis. Anti-tubercular drugs are doing their best, but as there is, with the effects of the anti-tubercular drugs, as there is deficiency, or there might be deficiency of vitamin B6, you are adding vitamin B6 to that. So like thyroidinum, it is a very good drug for as given as adjunctive therapy. You are giving a patient, say, calcarea cup, say, lachesis, say sickle cornatum, or whatever maybe you are giving. In the course of the treatment, you are giving thyroidinum, which we homeopath may call as a reactive remedy, which we homeopath may call as a remover of the stigma of the case, which we may call about, say, nosodes and sarcodes can be prescribed or may be prescribed in case where there is a halt. I mean, there is no more, you are not being able to see a better follow-up. I mean, you are not being able to see the patient. Patient is not telling you that he is better. So in those cases where there's a halt, where there's a stoppage, apparent stoppage of the case, patient is not getting benefited by any other medicines or so. So nosodes and sarcodes sometimes act well in these cases. So it can be given as an adjunctive therapy, which I spoke about. And adolescence and during the time of growing period, you might be having many mental symptoms in girls as well as in boys for the different hormonal issues we get from the gynecological books, the premenstrual syndrome, the premenstrual tensions and all. My doctor friends, please remember thyroidinum in such cases, because this is everyday clinics which are dealing. So we all know, because I'm not going to elaborate those things in what happens in case of the child, the adolescent girl or boy become very irritable, they have mood swings. So even thyroidinum, even in cases of after childbirth, be it is a cesarean section or it is a normal delivery, if you have a prolonged lochia, it's a prolonged bleeding, thyroidinum is a very good drug. It's a very good indication. There is another very important aspect of thyroidinum in hyperpituitarism resulting in amenorrhea. See, sometimes in cases of high prolactin, I mean prolactinoma, I mean high prolactin in the blood, we sometimes go for the prolactin assay in different dilutions. We sometimes give the tests. So in such cases, patient tells us, doctor, I am having amenorrhea, I have no menses for 6 months. So 6 months, you perform all the tests, pregnancy test and all these things, you're not getting anything, you have a high prolactin level, high prolactin in the blood, and there's a good scope of thyroidinum in such cases. So that is hyperpituitarism. The tuberculinum being the another very important remedy for the non-specified. I mean, the cases of amenorrhea, when you are not being able to specify the causes of amenorrhea. During menopause, often indicated for the menopausal symptoms. We all know what are the menopausal symptoms: the menopausal flash, the irritability, the ringing in the ears, sometimes the flashes, the feeling, the heat intolerance, and all. So this is a very good indication of thyroidinum also. These are all again from the everyday clinics I am talking. So there is nothing apart from the everyday clinics which I prescribe. I am just discussing with you. Dr. Ghosh states that allergic manifestations are very well covered by the symptomatic remedies. Thyroidinum, along with other remedies, which I spoke about in my earlier CMEs, and also I have spoken today. Other remedies such as tuberculinum, medurinum, soinum, and sulfur do well to prevent the recurrence. Please mind the drugs: the sulfur, the sorinum, the tuberculinum, and the medurinum. These are the drugs. Again, 2-3 are the no-so. I mean, 2-3 drugs are the no-sodes. So they have the reactive powers in the system. So it is a which I spoke about as per Dr. Ghosh also. It's a routine remedy for rhinitis recurring often with every change of weather. And there is another very good indication of thyroidinum, which I should speak, which I give in my I prescribe in my everyday clinic. That is eczema. That is atopic dermatitis. It's a very good reactive remedy. In my clinics, whatever whoever the patient of eczema is, it be it's a child, it's an adult, it's from the extremes of age. If it's a case of eczema, apart from the indicated drugs, I am going to give thyroidinum, I am going to give tuberculinum, I am going to give arsenicum album, I am going to give sorinum, and there are other drugs also. Sometimes juglans cinerea is there, then comocladia is there. There are some other drugs as per the indications of the drugs. So in thyroidinum, I should add one point about eczema, that is where, see, what happens in the case of eczema. These are the extremely itchy lesions. Patient goes on scratching, and that leads to hyperkeratosis. That is the thickening of the skin, that hyperkeratosis with the eczema. There are some eczemas, those are dry eczema. There are some eczema which are weeping eczema, I call. I say it weeping eczema. Weeping means this is exuding. I mean, lot of secretions are there, lot of the sticky secretions, oozing fluids like that. Patient goes on scratching. In both the cases, the dry form and the oozing one, thyroidinum is very much indicated. And the hyperkeratosis part of the eczema, which is a very good clinical hint, and it's a very good objective symptom in case of when prescribing thyroidinum. So there is another very good indication of thyroidinum is food allergy, which I spoke about earlier. Whatever may be the food allergy, you can give thyroidinum blindly. Take a chance, my doctor friends. Give thyroidinum. Wait for 15 days. Give it in 30 or 200 potency. Wait for a fortnight or a month, and let's see what happens in the case. So it is also a very good drug in the patients of diabetes mellitus type 2. I'm not saying that you are getting a case of thyroidinum, you are getting a patient of diabetes mellitus type 2, you are telling him to stop all the allopathic medicines and you are giving thyroidinum. No, I never do that. But I take the history of the diabetes mellitus in him, the type 2 diabetes mellitus. That helps me prescribing thyroidinum. That helped me connecting the dots of the thyroidinum. I mean, that helped me connecting the other symptoms of thyroidinum. This is a very strong point of my practice. I have to deal in my everyday clinics. I have to deal with a lot of patients because I don't have much time, which I spoke about in my earlier CMEs. Probably I have spoken about. So I don't have much time taking the mental symptoms. What is your fear? What is your emotion? What do you do when your mother scolds you? And sitting like this and looking for the patient's expression and then taking 1 hour for the case taking. Sorry, my doctor friends, I don't do that. It is not possible for me. Rather, I keep on asking the symptoms or the history or the family history or the past history, and I correlate those with the drugs which I'm going to prescribe. Say patient is a diabetic patient. I am getting a case, say patient has come to me with extremely itchy eruption, that is urticaria. On examination, I found it is urticaria. Patient is diabetic. I won't take much time prescribing thyroidinum. This is my way of my practice. People may differ, the doctors may differ with me, but as I am getting diabetes in the background of the patient and the urticaria, which is a very cheap symptom, it's a very dominating symptom of thyroidinum, so I am going to give thyroidinum. So, but in cases of diabetes mellitus type 2, I have never given. I don't give. I'm not going to give thyroidinum. So I take the history of that only. It's a very good clinical hint given by Dr. D.M. Fobister. He is telling that Dr. D.M. Fobister, if a child's general health is improved after an acute infection, thyroidinum 200 helps him later on, even in adult life. I am just repeating one more time. As per Dr. D.M. Fobister, Donald Rumsfeld Fobister is a very good doctor of Royal London Children's Homeopathic Hospital. He's a stalwart. If a child's general health is improved after an acute infection, thyroidinum 200 helps him later on, even in adult life. Okay. So I am just allow me to read 1-2 lines from the Fobister's book. Just allow me, please. In the page number 165 and 166. So Dr. Fobister is narrating a case. A case is a very big one. I'm just giving you one point, as there are many controversies, there are many discussions regarding single remedy, single prescription, which I spoke about. I don't give. I am not a believer of single remedy. So that I can say strongly, which I don't do in my practice. I cannot say that. I'm just narrating one single part, I mean a small part. He had a case in Royal London Children's Hospital. I'm not going into the detail of the case because it's a very big case. In view of the definite improvement after Helleborus, I prescribed Helleborus 1M. Dr. Fobister prescribed Helleborus 1M combined with thyroidinum 1M 1 dose on account of its effect on allergic conditions, combined with 1 dose of thyroidinum. So that I do in my practice also. I combine the drugs. I don't mix the drugs. I'm giving medorinum and thyroidinum. I'm mixing this medorinum and thyroidinum. Sorry. But I combine the drugs. Today I'm giving thyroidinum. Tomorrow I'm giving, say, some other drug. Maybe it is lacasis. Maybe it is sulfur. Maybe it is other drug. Okay. So these are from my understanding about thyroidinum, what I do with thyroidinum. Now I should narrate in nutshell about some more indications from different authors, which also have been verified clinically in my practice. What Dr. Allen says, Dr. Allen's keynote: weight loss, unexplained. We get often in our clinic. You are not getting any pathology, unexplained weight loss. That is thyroidinum. Fainting spells. I spoke about vasovagal phenomenon, vasovagal attacks, fainting spells. Many cases you get in your people get often faint. It's not. I'm not talking about hysteria. I'm not very vast about hysteria. What it is exactly? Okay, lupus, SLE. Psoriasis. In my everyday clinics, I do get many cases of psoriasis. Today also, I saw a case of psoriasis also. So most of the days I get cases of psoriasis. My routine prescription is thyroidinum along with other drugs like radium bromide, Kalias, sometimes other drugs also, phosphorus also sometimes I prescribe, sometimes I prescribe oleander also. So scleroderma. If you get a case of scleroderma, my doctor friends, please think of thyroidinum once. Desquamated, dry, peeling of skins of hands. This is one good India. And hyperkeratosis. Sometimes you are not getting any eczema on the palms, but if you go handshake with the patient, shake hands with the patient, if you do that, you get the feel of the hyperkeratosis of the patient. So it is thyroidinum. Sometimes a good clinical hint takes us to a remedy, a prescription, a constitutional prescription, or a prescription, or a similimum sometimes. Constant sleepiness is another indication of thyroidinum. Flushing with nausea is another indication of thyroidinum. These are all clinical hints. Profuse perspiration. If you go on seeing the Pathak's repertory, I don't know whether I have that in my I just need to check whether I have that Pathak repertory here. Yes, it is probably here. Let me tell you, just a moment. The symptom and the drugs. Sweat, profuse, drenching. What are the drugs? Dr. Pathak, Dr. Esa Pathak, a very good keen prescriber. What he is giving? What are the drugs he is giving? Carbo animalis in second grade, China is first grade, causticum in lowest grade, acid phosphoric is second grade, sorinum is there, silicea is there, thyroidinum is there. Another very good important nosode is there, that is tuberculinum. So it is thyroidinum. So it is again stated by Allen, Dr. A.C. Allen, this profuse perspiration. It is a good concomitant of thyroidinum. It's a very good, another indication, it's a good galactagogue. What is a galactagogue? Sometimes the patient, I mean the mother has delivered a baby, and she wants to breastfeed the baby, but the quantity of milk is poor. There is not the adequate quantity of milk. So again, this is a very good clinical hint. It's a very good galactagogue. You can give thyroidinum, you can prescribe thyroidinum, you can think of thyroidinum in such cases where it may increase the secretion of milk. So this is given by Allen, and Boric gives a few good clinical indications about thyroidinum. From Boric's point of view, I have verified some of. I am just narrating those. First point is delayed union of fractures. I had a case. In a fracture. Probably she had a tibial fracture, and the patient was aged patient, so it was not healing properly. So from Boric's Metria Medica, I read that Boric's Metria Medica, the symptom, it is a very good clinical hint, the delayed union of fractures. It's not that you are not giving the plasters, you are not doing the internal fixations, you are not doing the external fixations. Whatever the orthopedic measures are to be instituted, are to be given, that has to be given in a case. But apart from that, you may think of thyroidinum in case of delayed union of fractures. I'm not talking about malunion. I'm not talking about non-union. There are proper unions, there are malunion, there are non-union. All the students of the surgery, those who are in third year, fourth year, they have the topics, they have the short notes, they have the short questions about those from those topics, non-union, malunion, and all. Though I'm not going into that, but it's a delayed union. So another very good indication of thyroidinum is rheumatoid arthritis. It's a very good indication. It's a reactive remedy. This is the poor and arrested development of children. The development, the patient, the child is growing. Certainly, the growth has a stop. I mean, has put a stop. I mean, there is no more growth. You can give thyroidinum as a reactive remedy here. There is another very good indication of thyroidinum because we do get a lot of cases of fibroadenoma and fibroadenosis in our clinics, in our everyday clinics. Doctor, in cases of fibroadenoma, I cannot say I have much benefit with the thyroidinum, but sometimes in the cases of fibroadenosis, thyroidinum helps. In these cases, 200 potency, which I prescribe often. And another very good clinical hint in case of children or we know from the pediatrics that nocturnal enuresis is common in up to 5 years of age in case of girls, and for boys it is maybe up to 6-7 years, but not more than that. It should go by that time. I mean, it should not be there after 6th or 7th years of age. But if it persists, sometimes in the adolescence I get the nocturnal enuresis. Even the adults also, you also do get the cases of the adults, they are having nocturnal enuresis. Thyroidinum is a very good indication. These are all clinics. So another very good indication of thyroidinum is morning sickness. Morning sickness. Sometimes patient of pregnancy, I mean those who are pregnant mothers, they are not being able to eat properly because of the morning sickness and all. It's a very common symptom of pregnancy for the first trimester. I mean, in the first trimester, patient has the morning sickness, but if you have the symptom in an accentuated, I mean, if the symptom is accentuated, I mean, doctor, I'm not being able to eat anything. It's so profound in case of me. I know it is a common symptom of first trimester of pregnancy, but it's for me it's too much. Even I am not being able to taste any food. I'm not being able to take the smell of the cooking food. Apart from CPI, apart from arsenic album, you might think thyroidinum in such cases. So marked sensitivity to cold, which I spoke about in case of thyroidinum. Today is a very hot day. It's a very humid hot. So they have the cold hands. They have the, again, that is also somewhat which I spoke about, the vasomotor imbalance. One hand cold, another hand is hot. 1 feet cold, another feet is hot. We know lycopodium, we know medurinum. So thyroidinum is, again, those are also having the symptoms of the vasomotor disturbances. The lycopodium is a very good drug. So again, this is thyroidinum, the vasomotor phenomenon, the imbalance. One hand is cold, the other hand is hot, or the both hands are cold, which should not be. In the winter season, sometimes you get the cold hand, that is common. That is not always common, but that is sometimes you may get in case of patients. But in the season summer, in the season of summer, you may get the hot hands or the cold hands. The one hand is hot, another one, or the warm, another hand is cold. It is again a very good indication of thyroidinum. So the change, the aberration, the inequality, the equilibrium is not there. Where there is not in the equilibrium, the health is not in the equilibrium. So there's a very good strong clinical hint. Persistent headache, I told, but Borik is mentioning that it's a persistent frontal headache. I'm not telling you to give blindly thyroidinum in case of persistent frontal headache, because there might be a number of pathologies in frontal headache, as we know from the practice of medicine. But you may consider thyroidinum in the course of the treatment in such cases of frontal headache. Then you have the very good concomitant. It's a very good general symptoms, that is desire for sweets. It's a very good indication of thyroidinum. Thyroidinum patients eat sweets, and probably I don't remember. Let me check with the Pathak's repertory, Dr. Esa Pathak's repertory. Cravings, sweets, yes, sweet things, that is thyroidinum. And they have the weakness. He has a short rubric, I mean the sub rubric. Craving for sweets, weakness with, that is also thyroidinum. And sometimes thyroidinum child takes sweets only. I mean, they love sweets. Some patients, some children come to me in my clinic. They say, doctor, their mother tells me, the doctor, they go to the kitchen and whatever sweet items they get, they go on munching those. So this is a very good clinical hint of thyroidinum. And then there are skin cases where you are not being able to there's a sluggish reaction in the skin cases. If you get a sluggish reaction, I mean, the skin cases are not yielding properly to the indicated medicine or so. Again, this is thyroidinum. Is a very good clinical hint of thyroidinum, the sluggish skin cases. And let me see whether I have missed anything or not. So far, yeah. So far, I have completed about thyroidinum, which I do in my everyday clinics. So now I have finished. Thank you very much. If you have any questions, you can ask me in the chat box. You can ask me. I'll be happy to give you the answer. Hope I have not given much time. I have not taken much time today for the seminar. Thank you. Thank you very much. Orko, please. Hello. 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 Hello.
अच्छा ठीक है ओके ओके so thank you Dr. Vivekananda for your exhaustive discussion about your clinical applicability of this important notion. So from your this going through the literature available and into the form of materia medica and reparatory, as well as from the your clinical practices. All the viewers, including myself, we have learned a lot. But in addition to that, this thing in my practice, I this also frequently use this medicine, and on the basis of the some background, on the basis of this past history and family history, especially for these children and the women, if there is the history of the repeated abortion, there is this during pregnancy, if the complication of the pregnancy are in one or the another form, it may be this hyperemesis gravidarum, it may be preeclampsia, it may be this actually there is eclampsia or any other. This it may be this hyperglycemia, this pregnancy-induced hyperglycemia or hypertension, and if it persists for the longer period of the time, for me that is a good prescribing point for this either women and their children, whatever the clinical presentation is. And into the family, if there is the family history of any metabolic disorder, maybe diabetes mellitus, maybe hyperuricemia or hypercholesterolemia, that is also one indication for the prescribing of thyroidinum. So, and for this skin disease, if the skin eruption or the rashes, they are bilaterally symmetrical. So there are the in repertory you will get the many other medicine like arnica, sepia, lacdipronate, many other medicines are there. But thyroidinum is also very good medicine for that bilaterally symmetrical distribution of the skin rashes. And for this either the fibroadenoma or the fibroadenosis of the breast, in such cases also I have this there are the good result if there is bilateral, and then thyroidinum is also the one indicated medicine. And this thyroidinum carcinosin, these are the medicine here on the basis of the presenting symptom, that is very difficult for me to prescribe. So we have to rely on this past history, on the family history for that. And in that cases, there is the from the available literature, though this maximum is usually the people, they go from this like the Dr. S.K. Ghosh, my experience with some rare nosot. But in addition to that, there is a good book that authored by 3 of the alumni of NIH Association, that is the Homoeopathic Materia Medica of Sarkot by Dr. Chaturbhuj Naik, Dr. Smita Brahmachari and Dr. Sayyid Afsar Ali. So who want to know about the thyroidinum more, so they can go through this book. And for the women, for their life, there is the many a time there is the hormonal this not disturbances, that is the part of the physiology. So this thing occurs either during this menarche, menopause, during pregnancy and lactation. So for this any kind of this disturbances, so we can think of thyroidinum. So if there is the other indication are there, and when we are prescribing thyroidinum, that if there is the fever, it is better, or it is thyroidinum is contraindicated, that in the presence of fever that it should not be prescribed. So and for any chronic complaint, if nausea and vomiting they are present, nausea and vomiting if it is the present, that is also another important indication for the thyroidinum. And for this, in addition to this desire for this sweet, there is the desire for cold drink, that is also present into this thyroidinum. And it is said the patient is depressed, lethargic and quarrelsome, and this thing very complaining in nature on the mental sphere. And there is the patient is thyroidinum is considered from the miasmatic standpoint as the psychotic predominates, and as per it is mentioned into the book of the Dr. Odhikari as well. That is also a very good book, Picturesque Materia Medica by Dr. S. Odhikari, our respected teacher. So there is the patient is suspicious as well, and there is the mania is there. It may be into the form of this puerperal mania or this any mania during this actually that developed during the pregnancy, and any acute mania. So thyroidinum can be thought of. And thyroidinum is considered a predominantly chilly patient. Though in my practice I have seen that though patient is not chilly and rather hot, they also responded with this thyroidinum. So, and many a time on the physical makeup of this thyroidinum, there may be paradoxical obesity may be present into the form of this either the pelvis or the heavy, this hip, they may be heavy, or there is this actually dilated vein present on the extremities, both upper and the lower, and there is this pretibial edema. So edema, it is also very one, as Dr. Vivekananda has nicely mentioned, in different form of this urticaria and different form of this allergy as well. So in addition to that, it may be any kind of this edema, and this edema may be, in many authors says, that is the non-pitting edema. Thyroidinum, it is a good indicated medicine. So there are in previous seminar 114. So there was no scope to hear from the other this actually experienced teacher and like the Dr. Our president of our organization. So Dr. Kalyani sir. So I don't want to add much more. So I want to this before Dr. Umar. So before that, I am not going to this. So there are the some repertorial excerpt is there. So that I am not going to discuss this thing. So the slides are there. I will. So I will ask Bidyut to add on the slide. So from the Murphy repertory and from the synthesis repertory, so this how many rubric they cover, what are the single domain rubric, what are the second and the first, this actually third grade rubric. So that have been added. So I am not going to discuss this thing. So anybody who is interested, share. So if who are interested, so who are interested, they can go through this thing. So now I again thank Dr. Vivekananda Chakravorty for his exhaustive and very informative lecture on thyroidinum. And again, in addition to that, one excerpt from this actually another view into the homeopathy, that is about the drainage remedy. And we expect him to learn from him again in future. And now I request our president, Dr. Kalyani sir. Sir, now we want to hear from you. Thank you for giving me the opportunity to speak here.
Hello, just a moment. I'm taking one moment. Hello.
Yes,
I'm just taking. Thank you, Dr. Motin. You have nicely narrated many other aspects of thyroidinum. Thank you for that. And Dr. Virendra Singh is asking about, is there any rationality not to think thyroidinum when patient of hypo or hyperthyroidism problems? So taking into consideration about the primary hypo or hyperthyroidism, I am sorry to say I am not going to give a patient of primary hypo or hyperthyroidism a case thyroidinum in any of the potency, be it 230, 1M, 3X or 6X. Because in case of hypothyroidism, that is primary or central hypothyroidism, where the gland itself is not performing and the TSH is high. So in those cases, I do tell patient, what is my idea I am telling, I am just sharing, I do tell patients to go to an allopath or an endocrinologist, because you need synthetic thyroxine, as we need to take food when we are hungry, as well as your thyroid gland is hungry, it is not being able to produce thyroid hormone in adequate amount to perform all your physiological action properly. So please go to them and take thyroxine in synthetic form, whatever the dosage is being, it will be given by the doctor. This is one answer. The second answer is for hyperthyroidism. For hyperthyroidism, the case is reverse. As we have some of the cases in our Metria Medica as well as in the literature that some of the cases of hyperthyroidism are being cured by thyroidinum itself. I never prescribe that, and I am sorry to say I don't have any experience of having a patient of thyrotoxicosis or primary hyperthyroidism with the great with the exophthalmos and all with the with the lead lag signs and all the symptoms which we get from the practice of medicine books, I am not being able to prescribe thyroidinum, because what is my logic into this is, see, if anything is there, this is simply my logic. I am not going into anybody's logic, or I am not saying about that who is correct or who is wrong. If in a case of hyperthyroidism, already the thyroid gland is in the state of hyper, I mean, it is producing more thyroxine hormone. So if in any chance, if I augment the case with the homeopathic thyroidinum, with the homeopathic potentized thyroidinum, it might aggravate the case. So in that case, I even don't give. The next one is Prashant Shahai, who also asked one question. Sir, please also explain when we have to give thyroidinum in 3x, 6x, or 200 or 1. I usually prescribe thyroidinum in 30, 200 or 1m potency. I don't prescribe, usually that is not a very usual prescription from my side, of 3x or 6x. Sometimes in cases of skins where the skin manifestation is too much, I mean, not in the cases of urticaria, but in the cases of eczema or the psoriasis patients. I'm specifically telling you that in the cases of, there are a lot of discussions required for this. It's a very good question he has asked. In the cases of the eczema or the atopic dermatitis with the hyperkeratosis, or the urticaria, is an extensive urticaria. Sometimes if I get an indicated remedy, be it lachesis, be it phosphorus, be it calcareous, be it whatever maybe, be it natramure even itself is a very good drug for urticaria. If you read the literatures, also Dr. Diwan Horishad is telling, also other, even Dr. P. Shankaran is also telling, it is a drug which liberates toxins. I mean, not the toxin per se, which I spoke about in the earlier. Toxin means there you are injecting a toxin in the body, you are injecting some toxins in the body, and it is liberating that. Not I am talking about that. So it's, even natramure is a very good drug for urticaria from the Materia Medica point of view, we know. So in those cases, sometimes thyroidinum 3x I give I seldom give it. And one more point, as Dr. Prashant Saha is telling, 3x and 6x, regarding 3x and 6x, sometimes with the constitutional remedy or indicated remedy, in a case of uterine fibroid, I prescribe thyroidinum 3x or 6x. With that, I am not telling that I am giving singular remedy thyroidinum 3x or 6x. At the background, I say it is a case of uterine fibroid. I take the symptoms. It's a case taking, be it a small case taking or a big elaborate case taking. I'll end up in giving calcarea cup. Along with that, I am prescribing a mother tincture, that is maybe Fractionus americana or Bellis perennis, whatever it may be. Along with that, sometimes if I get those corroborating symptoms of thyroidinum, I may augment it, or in the background also I give thyroidinum 3x or 6x in the uterine fibroid specifically. Even in those cases of uterine fibroid, especially the submucous one where there is much hemorrhage and patient is not immediately fit for surgery. I am telling immediately fit for surgery, because to make a patient fit for surgery, it takes some time to convince the patient who comes to us. There are different perspectives in our practice, which I must say, sometimes patient has different idea. Patient doesn't want to take antibiotic, they come to us. Patient doesn't want to go for surgery, they come to us. Patient doesn't want to take the allopathic medicines as it is a conventional thing. So patient might have the feeling that they might have some different effects, so they come to us. So then the patient approaches us for the homeopathic treatment, and we start, after taking the concept, we start giving their treatment. So these are the different aspects of that. Thank you very much.
So thank you, Dr. Vivekananda Chakravorty, again for your answering the question asked to you. So, sir, Dr. Kalyani, sir, we are waiting to hear from you regarding all the three medicine, carcinosin, insulinum, and thyroidinum, from your experiences and knowledge, sir.
Okay. Thank you, Professor Abdul. Many thanks for fantastic moderation. Thanks to
Thank you, sir.
Parvez for fine inauguration, and many, many thanks to Vivekananda. He deserved exam training standing salute. That's really what I feel, that Vivekananda was traveling with us as a guide to move from one literature to the other, from what one told us to other, from his 3 generation experience regarding thyroid today. Fantastic. We can never expect this type of class in any classroom regarding thyroid. So anyway, many, many thanks to all, and many things we have learned. What I want to add a little more as per my experience is concerned. Am I audible clearly? Am I audible?
Yes, sir. Yes, sir. You are audible, sir. You are audible.
First, let me tell about insulin. Insulin. Oh, because before giving information of my personal experience, I want to tell you something. That the more days are advancing, I told repeatedly that we are purchasing complications, physical, mental. More we are becoming civilized, more we are advanced in communities and other amenities, we are purchasing discomforts regarding mentality, physically. As a result, very rarely nowadays we will find simple mathematic disease. Most of the diseases are complex mathematics because we have made ourselves complex, both mentally and physically, due to different types of social stimulation. Professor Dr. H.P. Day, right, used to tell us NIHians are consultant homeopaths. Teachers and students of NIH are consultants because they are the cream of the homeopathy. None of them will be a regular daily practitioner by Naxumika Beladonastras. Referred cases will come, critical cases, incurable cases. So NIHians are all consultants. Sorry. To become good consultant, we should arouse. It was personal Professor S.P. We should arouse much above the common anti-miasmatic, constitutional, symptomatic drugs. Because human civilization is making us, as they are making critical, complicated cases, as they are making critical, complicated human beings mentally, physically. So we have to become more complicated, more capable regarding decision making. Drugs. We cannot simply depend on anti-miasmatic drugs, Puja, Maxol, and Sulfur. The thing is that these type of drugs, common drugs, are used by common doctors. When they fail, they only search for the consultants. They search for the best doctors who is being famous for curing referred, refused, or critical cases. Then they will come to us. So NIHers must be very, very, very strong in nosol, sarcodes, imponderability, etc., etc. As Dr. Vivekananda was telling, we must have all the drugs ready in our hands because majority of the cases will be complicated to us. This was my teacher's version. And by virtue of our experiences, we are seeing the same thing very frequently, rather infrequently. Number of cases we are compelled to give no source or sarcodes. Otherwise, we are not getting perfect view. Now, regarding my few experience, I can tell you. Let me first tell you about insulin. I will tell you one case, a recent case. A lady of 17 years was brought to me for juvenile diabetes. He was under insulin injection He was studying in the school, in the verge of higher secondary examination. Parents were very much tense what will happen. When the lady was brought to me, he was becoming very, very pale, as if severely anemic, with all the data of very high sugar, not being perfectly controlled by injection also. That's why they came to me. I took the history in details, but what I found, very common drugs behind the lady, that is Parcetilla. And I thought, oh, he was also under homeopathic doctors, a number of doctors, with no change. I decided it seems to be Parcetilla, but it can never be Parcetilla, because any doctor who lays minimum, he knows Parcetilla. Her appearance was typical Parcetilla, mild, gentle, as we see in the literature. So this typical patient of the typical task was ignored, it cannot be imagined. Then I decided, let me do the things as allopathic doctors are doing. They are introducing ingested insulin. Let me try once by giving our insulin regular. As Vivekananda was telling, he is trying, he is experimenting by different ways to utilize homeopathic medicines, not completely stick to the constitution only. I tried these measures. And it was astonished, unbelievable. Within 2 months, the lady started reducing the sugar level, along with the insulin injection. Injection was continued, plus our insulin potentized medicine and placebo. It was found that within 3 months, sugar level came within the limit by insulin injection or our insulin. In another 2-3 months, patients started getting lower blood sugar level, BP and fasting both. And the pallor was sustained, severely anemic, 6.2 hemoglobin level. Seems to be blood transfusion, as I was avoiding. We were trying to see what happens ultimately. Then I concluded, why not we can think of Syncona? A severe diabetes usually should not have that relation with bone marrow depletion for anemia. But specifically, anemia is being sustained. Patient is very pallor with average health. We gave him Syncona, and the pulse was continuing. It was astonished to listen that in another 2 months, blood sugar levels started coming down below the normal level. I asked the patient to take, with the advice of the allopathic doctor, whether insulin injection can be withdrawn and can be given by oral only. The doctor was very nice. He agreed and stopped injection, started giving orally. Asked him to continue along with our medicine and on Syncona only, our medicine. Then lady started improving anemia, started increasing his appetite, restless, appeared in the examination, freshly. Weakness has reduced. Now he's able to walk, move, run. I stick to the medicine. What I find, gradually insulin, your sugar level is coming down than normal. But allopathic oral medicines also. Then I ask the patient, now we can take the trial to withdraw, take every alternative for 15-20 days. If you find, and go on testing every 15 days blood sugar level at home. When you find this coming down normal, not crossing the upper limit, then take every 3rd day. In this way, gradually, injection, then administration of insulin was stopped. Homeopathy was continuing. Patient blood sugar level became normal. I stopped repeating insulin. Stick to Syncona. Now the patient is completely normal. No blood sugar. Patient is quite trendy. Anemia has improved. He is now studying in college. Fresh and fine. So this is homeopathy. As we find homeopathic individualization regarding case taking, it is my conception and experience that homeopathy is individualistic in every aspect, in a repetition, in a selection of potency, in type of administration. It varies from person to person. It is also individualistic. As Dr. Chakravorty was telling, he's experimenting in different ways. Repeatedly, I tell my students that if Hahnemann could have been arrived till date, there could have been 66 editions of organon than 6. Every day we should improve, we should grow and grow without disturbing the basic fundamental principles of the homeopathy. We have to cure the patient. This is our target. Matters little whether we palliate or give some additional drug or complementary or other associated drug or antimalarial. Everything has been given organ. If we search thoroughly, it has been given that 2 drugs can be given, where Syncona can be given to reduce intermittence of a fever. He's under 1 drug. Still, you can give Syncona. It was Hahnemann to tell us. Moreover, a patient had a suffering several years under thyroidinum. He had a great fall from the roof, had fracture. Don't you feel of arnica or other calcium or other drugs to get relief of the patient? So are we crossing homeopathic principles? These are the things we should experiment. We should try and try. Then we'll conclude. As Dr. Bidyut was doing fantastic. We'll learn from everybody. Then one more insulin indication why I used to give it, that if I find any patient who is having wound, ulceration, skin disease, any complicated disorder, and diabetes, anti-diabetic drug, there, our homeopathic insulin is fantastic. You can use it. I'm sure all of you will get the experience. That patient is taking insulin, is having blood sugar level either controlled or not controlled, but the complaints are not going easily. Wound or other ulcer, enteritis, gastritis, any discomfort. Common drugs are not responding. Think of insulin 200 or rather suitable potency, and you see the mystery. The complex will go by single medicine insulin. That's why I never forget to use this insulin in the critical conditions of the disease where blood sugar is persisting. Now let us come to carcinosin. Fantastic drug. You know that day by day carcinogenic agents are increasing in number. Day by day, different varieties of medicines coming for cancer treatment. What we have seen, a fantastic symptom of carcinosin. I will tell one example, life example. Then we are a student of NI, second year at Amma Street. One young boy came to the OPD and telling, sir, I have come from a long distance. Early morning I have started. Can you show me early? Where from you are coming? I am coming from, I do not exactly remember the name of the area, South Calcutta. You are coming from South Calcutta to Shialda since morning. It took so much time. No, I am coming on foot. Why? There are trains, there are buses, there are taxis. Why so much time? No, I don't avail these vehicles. Any car, any train, anything. I used to come by walking. And the question from us was to go from to other places other than hospital. How do you go? Sir, by walking. In your service, while you are walking, on foot walking. Why? I'm scared of accident. Did you have ever faced any accident? No, sir. Any of your family member was under accident you have seen or heard? No, sir. Why? Because I have heard that patient dies by accident. That's why I'm scared of traveling by any vehicles due to fear of death. This unusual fear, unexpected fear of little things is carcinogen. Another indication I'm telling. I know a person who is so bold, can catch hold by bare hand snakes, can tackle any animals. He can travel by two-wheeler to Ladakh alone, any highest corner, worst area of the country, to create new tourist spots. But he is scared of, you'll be astonished to know, scared of your spiders. Of what size? Even a size of ant. Such small spider. If he ever finds one spider, he will start shouting and jumping. Makursha, Makursha, Sikiristo, and he will shout in such a manner. People should run to him immediately, his family members, neighbors. He's afraid of even little most spider. Likewise, we'll find many times different types of patients scared of very little things, negligible things. This is carcinogenic. This is cancer. This is carcinoma. You can try, you will get fantastic result. Moreover, as we have learned, a family with carcinoma, if you find the case is not getting by any common drugs, even by some no source, apparently indicated nothing is doing, then we should not forget to try at least once by carcinogen, because we do not know the types of carcinogens in the society, in the foods and the atmosphere, by which effect he is suffering cannot be detected. That's why at least arrest the carcinogenic agents to the person by giving carcinogen once at least as an immediate minimum. And many things have been given by Dr. Chakravorty. Now let me come to thyroid. My first experience. One boy used to come with some other complaints, and one day his mother is telling that my boy cannot urinate within a short time, takes much time. Why? Because his urination is very, very narrow, very slow, narrow. The glands penis, prepuce becomes swelled up, very slowly urinate, takes more than 10 to 15 minutes to evacuate. How long this is happening? Just after childbirth, there was slowness, frequent urination, but the more the child is growing, this constraint of urination is increasing day by day. Case is phimosis, you know very well. I heard that Thyroidinum is a fantastic drug for pediatrics and obstetrics. I will tell you the history. I gave him thyroidinum without any indication, simply by that a congenital anomaly, without any specific reason, without any apparent cause, without any family history, he is carrying since birth. It astonished to listen that after a few days, one day the parents has ran to me and telling, sir, the area is bleeding and the skin has opened. What happens? They told at night he started itching seriously and was shouting, itching. Started itching seriously, there was tear, there was scanty bleeding, skin open, prepuce frenulum was open, glands was clear. This was thyroid. Since then, my first experience, I never forget to think of phimosis, congenital, at least once by giving thyroid. People not try. Not only that, thyroidinum I have tried in congenital diseases. I learned use of the thyroidinum, even higher potencies. If the students know from a gynecologist of Hyderabad, when I was dealing with mother and child healthcare in NIS as a nodal officer under IUS, then I met him. He was a gynecologist. He had different seminars in different cities of the country. I cannot remember his name. Muslim doctor. He is using homeopathy through and through. He never uses any allopathy medicine. He's a surgeon. Try to avoid as much as possible operations. He tackles with homeopathy medicine. He taught me, doctor, even higher potencies in a very early child is not harmful as it is given in the literature. I have seen this is helpful sometimes because the root is much deeper, where you can safely use higher potencies if there is no such acute situation which can be aggravated, especially for congenital. Congenital, any anomaly is very deep rooted, you can safely use. Since then, I started trying this thyroidinum in congenital animal medicine and OPD. ISD, VSD, ventricular septal defect, atrial septal defect, these type of phimosis, any other congenital abnormalities, without any specific reason, what is being instructed by modern system of medicine by surgeon, wait for a few years from 6 to 10 years. If it is not open or healed or not adhered, atrial septal defect or ventricular septal defect, then you have to operate. I have seen that by giving thyroidinum, cases are improving, provided the case is not calcarea false or calcarea carb, because these are two heading drugs, famous drugs for delayed milestones. Milestones are normal, vertex were healed normally in time, walking, talking, everything, dentist and all, perfectly right. But only one complaint congenital is sustained, not getting improved, either delayed or not at all improving, awaiting for the operation. This type of patient usually such good homeopathy, because people are scared of operation. Moreover, parents are very much scared of operation of a child, newborn child. They will run to one homeopath or any homeopath, and ultimately they will come to us for the solution. And homeopathy there stands great rule, fantastic. Any congenital abnormality without any apparent reason means no your pregnancy hazards treatment or no serious disease of the mother, or mother is not carrying any congenital disorder, or the disease itself is not at all congenital or inherited, but it is containing, it is sustaining. It should be given once at least by thyroidinum. One more thing regarding obstetrics, not exactly obstetrics. If a mother complains of many complaints, sometimes serious complaints, not getting replied, not getting improved by conventional system of medicine, drugs are not responding properly, the case is not curing, running from one homeopath to other homeopath, and ultimately, if they come to us, we should not forget things, two drugs, very nearing drugs. One is thyroidinum, other is sulfur. Both are hot in many cases. Both desire for sweet. But one is fastidious, tidy, other is untidy and casual. Any complaint since pregnancy, with or without any hazards, mother is carrying, like overweight, obesity. Since then, thyroid disorder. Since then, blood sugar. Since then, anemia. Since then, some other complications, systemic complications. Never forget to think either thyroidinum or sulfur according to the indications, who is nearer to the drugs. Likewise, as our teacher taught us, thyroidinum is a fantastic drug for many diseases. Dr. Chakravorty has elaborated told us. One more experience I can tell you. We had a project in NIH by 5 doctors for 5 years on thyroid dysfunction. At that time, NIH did not have the advantage of getting the T3, T4, TSH tested. Laboratory could not do it. We got the report tested for documentation, either from the SSKM hospital through BCI Memorial Hospital, because SSKM directly will not intervene any patient of NIH. As per rule, we usually used to send the patient to BCI Memorial Hospital in Wellington Square. They will take a minimum amount of government fees, they will give a bill, and the bill will be submitted to the SSKM hospital. On the same day, there will be blood test. Whereas normal patient of the SSKM, they have to wait for 3 to 4 months for blood test. This process was immediate. That somehow we could able to know. Or your cancer hospital, that Barasat Cancer Hospital, they used to do as quick as possible. So we started the project by WHO instruction. Few symptoms, if they are altered, say for example, if 3 symptoms are altered among these few indicated, then it is case of thyroid dysfunction. Likewise, as per clinical indication guided by WHO, we started the clinical research project. But when we found there are tremendous improvement, fantastic improvement, physically, mentally, then we started doing the test for documentation to this way, sending the patient to Parvez Cancer Hospital at SS Thomas. We found fantastic result. Serological patients are also improving. During those times, few patients used to rather impose us, request us, sir, please, should they stop allopathic medicine? What was our principle? That we should not immediately stop their medicine until reports become normal or until the consultant of the medicine department of NIH tells it no more needs toxic or new markers. So when you found the reports are also improving, if I get time in near future, I will show you the report. And physical structures are changing. IBD patient also improving. Grave disease improving. Then we took one measures as trial. As I was saying, everybody is free to take trials. And you never calls to stop. I am the last. What we did, what we did that we responded to the request. We asked the patient, okay, you don't withdraw immediately. Take every alternative and continue to take thyroidinum 3x twice daily 4 grains. And go on continuing the T3, T4 tested every third month. You'll be surprised to know that we found not only clinically, serologically, the levels are not increasing, rather reducing. Ultimately, many patients, number of patients, not 235, we had about 2,600 cases. We had to tackle all 5 research officials. It is so many cases. We then tried to experiment whether endotoxin can be stopped as early as possible. That we have seen thyroidinum lower potency repetition can supplement to some extent neomarkazole or endotoxin. So you can try of your own, give the constitutional drug for cure, but to withdraw the medicine as quick as possible, because you know these drugs, neomarkazole and other drugs are strong drugs. This ultimately cardiac complications and other complications comes or cannot be stopped, because in conventional system of medicine, you have to continue intoxins lifelong. So you were able to stop the medicine by giving repeated lower potency, and many patients got completely cured. So I'm requesting to all of you, you also try. I'm not telling you, please copy me or copy Dr. Chakravorty. You try. Trial and error is the only way to improve the science. We'll invite failures. Failures will be another success, because if we are failure, then we'll tell our people, our friends, our brothers that we have failed. We had this trial, we failed. This is another knowledge. So either succeed or fail. Try and find whether there is errors. Trial and error is a must for any improvement of the science. So there are many more things we can experience in these different ways. But as Dr. H.P. did insist us, to be very strong in no source and support as far as the civilization is concerned. Because previously we are only human beings, Homo sapiens, biological beings. Now we are our food habit, sleep habits, diets, addiction, your audition, vision, everything has changed a lot. Equally, our system has changed by giving repeated trauma by prophylaxis, drug administration, exposure, invasions, interference, different ways becoming physically, mentally, and systematically adulterated. Toxized. We're inviting iatrogenic diseases day by day, increasing number of iatrogenic diseases increasing. It is only homeopathy who can reduce the iatrogenic disease in the drug hazardous diseases. So likewise, thyroid toxin is a definitely drug. There are drug hazards in near future, short course of time. So if we can save the patient for taking regular drugs, or you can cure the patient, that will be great help for the society. So, dear friends, we are very much thankful to Vivekananda Chakravorty for his journey. All of will be with him. We'll be waiting for the next. No, sir. Thank you very much. Bidyut, please.
Thank you so much, sir. It has been an exhaustive session through and through, and we are really proud
You're not
that the
audible.
sharing of knowledge.
You have been muted.
Can you hear us? Hello?
You are audible. You are audible. Bidyut, you are audible.
Thank you so much.
No,
All
not yet, you are audible.
all the speakers who had. হ্যাঁ স্যার শোনা যাচ্ছে? হ্যালো, বিবেকানন্দ?
হ্যাঁ শোনা যাচ্ছে, বিদ্যুৎ দা শোনা যাচ্ছে।
Trying his level best, but
শোনা যাচ্ছে, শোনা যাচ্ছে।
software constraints. We are facing infrequently, but that could not stop us. Any difficulties in
That's
software
true.
system. Always they are telling us always.
Right,
There
sir.
is some problem.
And after so many challenges, we had been able to complete 116 CME tonight. No, sir. Today we are having the 116 CME, and though people are glued to the TV for the world news and all, but still we are proud to see that almost 100 plus live viewers in Facebook as well as in YouTube. So that's the power of Alumni Association, and that's the power of the contents and topics what we are trying to get it through. And moreover, on the next CME, which will be on 11th of, sorry, it will be on 9th of June, will be coming with the 117th episode with a new set of speakers and with a seasoned moderator, Professor Dr. Abhijit Chatterjee, and a new set of speaker. So till then, we will be waiting over here. And good night for tonight. We say goodbye. And with this, I'm returning to Orko Mukherjee. Dr. Orko, kindly conclude.
Orko, do you hear us?
I think Orko got disconnected. There had been some challenges. Orko is in Bardhaman now. So let me see. Yeah, Orko, please. Yeah.
Thank you all. Thanks for watching. I hope you have enjoyed today's CME. And if you have enjoyed, do make sure to give it a like, share it with your fellow mates, and don't forget to subscribe our channel for more content related to this. And also turn on the notification bell as to get all the updates regarding next CMEs. And also to get update on next CMEs beforehand, you can just go and check on on our WhatsApp channel. The link is in the description. Just click on that and you will get our next CMEs update over there. So join over there too. And with this, again, also those who are watching on Facebook, the link is also given in the caption section. You can check. And those who are checking on Facebook, please do make sure to share in your timeline so that many people get update about this topic. So with this, again, thanks to all. Thank you for watching. It's me, Orko Mukherjee, leaving out for now. See you on our next CME. Good night.
This channel does not promote or encourage any illegal activities. All contents provided by this channel is meant for educational purpose only.